Hi class, this is my video flashcard presentation for COPD for week 8. COPD, or chronic obstructive pulmonary disease, is an umbrella term for other diagnoses such as emphysema, chronic bronchitis, and chronic asthma. So the Global Initiative for Chronic Obstructive Lung Diseases, or GLOBE, defines COPD as a common, preventable, and treatable disease that's characterized by persistent respiratory symptoms with airflow limitation that's due to the airway or the alveoli abnormalities, and its significant exposure to noxious particles or gases, including abnormal lung development. So there are 3 major diagnoses that are considered to be in the category of COPD. The first is emphysema. In emphysema, there's a destruction to the lung tissues that leads to an enlarged, permanently inflated alveoli airspace. So in the lung tissues, our alveoli kind of look like grape clusters still on the vine, and those alveoli become hyperinflated due to the emphysema and the loss of elasticity and structure of the lung tissue. This often presents with a patient who is barrel chested and a hyperinflation of the lung, including air trapping in those alveoli, additional to partial lung collapse. The second is chronic bronchitis. With chronic bronchitis, there's increased mucus gland secretions, inflammation of the lung tissue, often coupled with infections such as pneumonia, or pulmonary vascularitis, and the obstruction is in the bronchi, so the branches that go out to the alveoli, most often due to a mucus production. And then the third, we have asthma, and asthma patients have more of an inflammatory process and a bronchoconstriction. This does increase mucus production and obstruction due to the inflammation. Repeated asthma attacks, often lead to damage of the small bronchioles. So your risk factors for COPD, interestingly enough, include health disparities. So it's found that patients have a higher diagnosis of COPD in rural communities, leading to the factors of health disparities, which is a consequence of greater tobacco use in those areas, poverty and lack of access to both health insurance and medical care. There's not as many pulmonologists in rural communities. Exposure to biomass combustion and agricultural occupational exposures, chemicals, mining, and pesticides. So your risk factors with emphysema are obviously smoking and tobacco use. There's a genetic component there as well, and environmental exposure to chemicals and inhalants. Chronic bronchitis, very similar. And then asthma, you have a hypersensitivity of type 1 for the inflammation process and a hypo-responsive tissues. So your major signs and symptoms are cough, persistent cough, with and without sputum being able to expectorate the sputum, shortness of breath, orthopnea, finger clubbing, weight loss, hypoxia, and secondary polycythemia. Here's a good illustration of kind of your normal bronchial lumen, how it's nice and open. And then with the COPD or chronic bronchitis, you have that kind of thickening and closing of the lumen that blocks the airway. And with emphysema, we have the healthy alveoli here. And as the loss of elasticity and the hyperinflation of the lung, you can see that alveoli is greatly reduced. So there's loss of surface area for gas exchange in both situations. There's loss of elasticity for expansion and contraction of the lung. And again, you have that risk of partial collapse or air trapping. Diagnostic testing to identify COPD patients includes PFTs or pulmonary function tests, specifically the forced expiratory volume of the lung, so the FEV1, and the vital lung capacity. CAT scans can identify COPD, as well as chest x-rays and ABGs to identify some chronic respiratory gas exchange issues. And here are my references. Thank you.